All right, my name is Haley Kloss. I am a postdoctoral research associate with the UConn Technical Assistance to Brownfields program, and we serve EPA Region 1, which is the New England region. Today, I'm going to be going over data mining for health impacts that are going to be really useful for Section 2 of the EPA Brownfields MAC grants. And we also have our UConn tab email provided at the bottom, as well as our UConn tab webpage. So before I go in too deep, I'm just going to start by describing what public health really is. So the CDC describes public health as the science of protecting and improving the health of people in their communities, which is achieved by promoting healthy lifestyles, researching disease and injury prevention, and of course, detecting, preventing, and responding to infectious diseases. So ultimately, public health is really concerned with protecting the health of entire populations, which can be as small as a local neighborhood or as big as an entire country or region of the world. And really, public health work really tries to limit health disparities. A large part of public health is promoting healthcare equity, quality, and accessibility. And how do we actually go about measuring and monitoring public health? So public health surveillance is the continuous and systematic collection, orderly consolidation, and evaluation of pertinent data with prompt dissemination of results to those who need to know, particularly those in the position to take action. And effective disease control programs really rely on effective surveillance and response systems. And so why is public health relevant to brownfield redevelopment? Public health matters because brownfields often can contain legacy contaminants, for instance, things like lead, asbestos, or solvents, and these can be and have been linked to asthma, cancer, cardiovascular disease, and even developmental delays, particularly in children. And so this type of health framing really strengthens an EPA Brownfields grant application. So key connections here are that brownfields disproportionately burden already vulnerable communities, and cleanup of these brownfields can reduce exposure, resulting in better health outcomes and health equity. And ultimately, healthier environments support economic redevelopment and overall quality of life in a community. And so that FY26 guideline review criteria, specifically for section 2C, which is what we're going to focus on in this webinar, greater than normal incidence of disease and adverse health conditions. And so the review criteria is as follows. So showing the extent to which this grant and reuse strategy or projected site reuses will address or help identify and reduce threats to populations in the target areas, with a greater than normal incidence of disease or conditions, including asthma, cancer, asthma, or birth defects. And so those are going to be the three main ones to include that may be associated with exposure to hazardous substances, pollutants, contaminants, or petroleum. And the note here that is in the NOFO does mention that if populations in the target areas do not suffer from a greater than normal incidence of cancer, asthma, or birth defects, then the response may only earn up to 2 out of the 5 total points for this section. And again, before we get too much into the data, I just wanted to backtrack to describe sensitive populations as they are defined in the NOFO. So this is particularly for section 2B, but it incorporates some of that health indicators that we're going to discuss today. So sensitive populations are described again in the NOFO as populations that are likely to experience elevated health risks from pollution, including populations based on age, so young children and the elderly, pregnant women, and serious disease burden such as high rates of cancer, asthma, chronic respiratory disease, coronary heart disease, low birth weights, etc., as well as low-income populations. And so again, what public health data should you include? So those key inclusions are going to be those rates of asthma, cancer, and birth defects. And then examples of some other inclusions, if needed, can be things like heart disease, chronic obstructive pulmonary disease, which is a respiratory illness, also known as COPD. Also looking at child blood lead levels or pregnant women, which you can get from the fertility data tables in the US Census data. So the first tool that I'm going to show today, and is probably the most useful data source for this Section 2C of the EPA Brownfields grant, is going to be the US CDC Places Interactive Map. So this shows data for county or census tract levels. And I'm going to go into the data tool in a second, which I do have linked here for your ease of use. So essentially, key things we can pull from here in that health outcomes tab, we can see prevalence of asthma and cancer. In the prevention tab, we can look at prevalence of lack of health insurance in an area. The disability tab shows prevalence of different types of disabilities. The health related needs tab can show prevalence of things like received food stamps, food insecurity, housing insecurity, lack of utility services, and transportation barriers in that target area. And then the non-medical factors tab just has some ACS demographic data. But again, I would recommend that you do pull that when possible from the US Census data tables. And one last note here is that this data is from a statistical model. So this is based on a survey and not actual incidence rates. And I'll show in the next slide after I go into the tool how these rates are actually calculated. All right, so when you first go to this link, you're going to be taken to this general page. And if you scroll down, you can see Visit the CDC Places Interactive Map. And so this map, when it first pulls up, all of the polygons that you see are counties. And then as you zoom in, you can actually see specific census tracts. So right now we are on the arthritis tab in the health outcomes section. So I'm just going to click on asthma because that's one of our key health indicators that we want to include. And so again, I'm just going to scroll into Connecticut. So these polygons show different counties. As you continue to scroll in, they should shift to being actual census tracts. Now, a useful tool instead of, just kind of trying to zoom into your particular census tract, unless you know exactly where it is, if you click on this little magnifying glass, you can actually search a particular address. So I'm just going to type in an address in stores, which is where we're located. So once you type in an address, the map should zoom in to that particular site. So you can see this pop-up result showing me the address that I typed in. Now, if you were to kind of click this general area, you'll see this highlight. And now I have highlighted the census tract that contains my target site. So you can see the tract number listed here. And then this pop-up should also give you some information about whatever health indicator that you're currently looking at. And so here it's showing that in this census tract, the estimated prevalence of asthma among adults aged 18 years and older was 11.5% in 2023. So I believe all of the most current data on this interactive database is from 2023. Now, that's how you can actually find the prevalence of, for instance, asthma. You could do this again for cancer, COPD, heart disease. But a big part of this section of the grant is showing that your target area faces a greater than normal incidence of these different things. And so how we define greater than normal, we suggest comparing your data to either the state average for that particular health indicator or the national average for that health indicator. So I do have some state data sources listed towards the end of this presentation, which I will show later on. But for now, how we can actually find the national level for indicators on the CDC Places website, if you go over here, right below that magnifying glass where I typed in the address, you can click Layers. And then if you click on Legend, this middle part should always show you what the national average is. So in this case, this particular census tract in Connecticut has an asthma prevalence of 11.5%, which is higher than the national average of 10.8%. So that is always a good way for you to check whether or not this area faces a greater than normal incidence of this health indicator. So again, you can do this for many different health indicators. This health outcomes tab is probably going to be the best one to use. But I did mention you can also look at prevalence of lack of health insurance in an area. You can also look at health-related needs. So again, received food stamps, food insecurity, housing insecurity, and even transportation barriers. So all of these things can help you in your narrative. All right, so I'm gonna show you in this next slide again how this data is actually calculated. So prevalence is based on responses to a survey that were extrapolated to larger geographic units. So an example of how they calculate cancer prevalence, a survey question might have been, have you ever been diagnosed with any type of cancer except skin cancer by a health professional? And so that cancer prevalence percentage is calculated as the number of survey respondents who said yes over the total number of survey respondents. So the second data source that I'm going to show today is the US CDC National Environmental Public Health Tracking Network. So this data source has data in terms of counts or percentage at the state or county level. So for most health indicators, you cannot get census tract level data here. Now, a couple things I'll note. This is the only data source, at least that we are aware of, that you can find data for birth defects on. That being said, the data in this particular source is difficult to obtain and mostly unstable. So you might not always be able to find data for the area that you're interested in. So how this works, and again, I will go into the tool, you're gonna see this query panel when you first go into it. So you can select a particular health indicator. So I'm gonna select birth defects. And then this drop-down list here allows you to search for a particular type of birth defect. So that's the other caveat about this particular data source. If you were looking at, instances of asthma or cancer, you do have to select a particular type. And so for birth defects here, something I want to note is that you want to choose a birth defect that can be related to environmental exposures instead of just kind of choosing one at random. So for instance, exposure to air pollutants, industrial chemicals, and heavy metals has been tied to anencephaly as well as cleft palate and others. So that's a neural tube defect. And I've selected that here. And then the other thing, it's going to ask you for a geography type. So again, I mentioned that data is only available at the state or county level. You would then select your particular state, and then you also want to select all years here. The advanced options is if you wanted to look at these health indicators for a particular age group, racial or ethnic group, or between males and females. I'm going to leave that blank for today. And then essentially you get this output map here that you can scroll your cursor over and see the prevalence percentage. So I'm going to go into the tool. So again, when you first open it, you should get this query panel. So you can select, which health indicator you're looking at here. Again, I would typically only try to use this for birth defects. Again, I'm going to look at prevalence of a relevant birth defect, And again, we want to look at prevalence, not number of cases. And then I'm going to go with county in Connecticut. And so again, we can see this is our output. So there are some counties here, about half of them in Connecticut, which do have unstable data. But again, if hovering your cursor over these different polygons, you can see the data there. Okay. Now, with all of that being said, so what data should we actually use? So I've mentioned this before, but again, you really only want to use indicators from places in the Environmental Public Health Tracking Network that are greater than national or state averages. So again, I showed you in places how to find that national average, and then for state averages, typically you can go to the state-specific websites to find those things. Now, if needed, you can look for additional state health data if you cannot find, data for asthma, cancer, or birth defects that is greater than normal incidences. So, for example, blood lead levels is a common one to look into. So in these next groups of slides, I actually have state-specific resources for all of the New England states. So again, these are all linked in the presentation for you to just be able to click on and access the resources. So in Connecticut, the Department of Public Health, for asthma rates, they have reports and data tables by census tract or town. The Rhode Island Department of Health has data tables and graphs. The Massachusetts Environmental Public Health Tracking also has maps and data tables by county. Maine Center for Disease Control and Prevention has an interactive map that you can peruse asthma rates again by county. The New Hampshire Department of Health and Human Services has interactive dashboards, so you can see data tables and maps by county, rural or non-rural area, and public health region. And then the Vermont Department of Health, again, has maps, particularly an asthma disparity map and yearly reports. So again, all of those resources are linked directly in the slides. And then some other useful state data sources. So these are for cancer. So the Connecticut Tumor Registry has data for different types of cancer by town, county, as well as statewide for different time periods. Rhode Island has the Cancer Registry, so data reports for different types of cancer by age and racial or ethnic group. In the Massachusetts data source, so if you click on Explore Maps and Tables, you can see age and gender-specific cancer rates for county, town, public health region, or census tract levels. For Maine, they have the annual cancer snapshot, which includes data at the county level. The New Hampshire data portal also shows cancer incidence rates by county, public health region, and rural or non-rural. And then in Vermont, again, if you click on the link and navigate to Vermont Cancer Data Pages or Vermont Cancer Dashboard, you can see cancer incidence rates by county. Now, again, this is an example of one of those extra indicators that you can include. So here I have linked some state data resources for lead exposure, so childhood blood lead levels or childhood lead poisoning data. And so again, in Connecticut, you can see incidence and prevalence number, as well as percentage by town, as well as statewide. In Rhode Island, incidence and prevalence is available by town, as well as statewide. In Massachusetts, there are surveillance reports, screening data, prevalence, and maps by year, town, as well as statewide. In Maine, blood lead levels, risk factors, number and percent, and maps available by year, county, town, as well as statewide. In New Hampshire, again, you can see prevalence and maps by year, county, town, and statewide. And then in Vermont, prevalence, percent, and maps by year, county, town, and statewide. So again, all of these data sources are linked in that table here. Now, one last note I want to make for your grant narrative. So again, the narrative criteria for greater than normal incidence of disease and adverse health conditions notes, these health indicators that may be associated with exposure to hazardous substances, pollutants, contaminants, or petroleum. So here we do not want to say that brownfields cause asthma, cancer, or birth defects, but more appropriate language would be exposure to contamination from the brownfield sites places an additional burden on the sensitive populations and may exacerbate adverse health conditions such as. So really keep that in mind as you're writing. And then just to round out here, I do have a bunch of links to some other useful grant resources. So the top panel here, we can see some webinars, both National Tab, EPA, as well as UConn Tab webinars that may be helpful, as well as some web pages and fact sheets pertaining to the information on the guideline changes between FY25 to FY26, tips on how to get started, lists of eligible entities and planning activities, information on site eligibility, the FY26 frequently asked questions, which is a really helpful document that we always suggest looking into. And then also I wanted to kind of plug UConn Tab Brownfield grant office hours. So we hold these every Tuesday from 12 to 12:30. Our last one will be on January 20th. You can join the WebEx link here. It's also listed in our UConn Tab webinars and workshops page. So feel free to check that out. And again, the UConn Tab program page is linked on the first slide. And then lastly, I also wanted to mention that UConn Tab does provide grant proposal review. So linked on the bottom bullet there is our submission form. So we are offering a first deadline of January 2nd, which is 4 weeks before the EPA deadline of January 28th. And then the second deadline is January 23rd, which is again 1 week before that EPA deadline. So definitely check out our services on our homepage. The UConn Tab email is also linked on the first slide. So please reach out if you have any questions, and we look forward to potentially seeing you in our office hours.